Good day, everybody. I'm Dr. Stefano. I'm an orthopedic specialized in spine problems, spine pathologies, and I work in Shark Hospital in Fujairah. So this morning we can talk about some problems of the spine. The most common problem compress the nerve, and the patient has radicular pain along all the leg. So you can see in the other model this red is. Good day, everybody. I'm Dr. Stefano. I'm an orthopedic specialized in spine problems, spine pathologies, and I work in Shark Hospital in Fujairah. So this morning we can talk about some problems of the spine, the most common problems of the spine. I mean the lumbar spine. The lumbar spine in which we have, as you can see, 5 vertebral body. The most frequent pathology of lumbar spine is disc herniation and spondylolisthesis. Disc herniation, it means that there is a prolapse of the disc, and this prolapse can compress the nerve, and the patient has radicular pain along all the leg. So you can see in the other model this red is meaning the disc that is compressing the nerve. So the problem is that after 15 days or 3 weeks maximum, we can have some physio, we can have some tablets, we can have some painkiller, muscle relaxant. But if the pain will not disappear after 3 weeks, probably patient has to undergo a surgical procedure. I know surgical procedure is, most of the patients are afraid in surgical procedure, but sometimes it's the only solution for this problem. Surgical procedure consists of obviously removing this disc, this red part of the disc, as you can see here. So we can remove the disc, we can make the nerve root free of compression, and so the pain will relieve. It's a kind of surgery that lasts about half an hour, at maximum 1 hour. Patient can stand the day after surgery, or if we do surgery in the morning, can stand and walk in the late evening, and after 2 or 3 days maximum can be discharged at home. He has to be, quiet without work for at least 15 days, and then he can return to work normally, return to sports activities, to gym, to his life, completely normal. That's why sometimes we can consider surgical excision of the disc for this kind of problem. Other problems regarding always the lumbar spine is the spondylolisthesis. Spondylolisthesis means that a vertebral body is slipping in the front. So there is 2 kinds of problems. Spondylolisthesis can cause a mechanical problem due to just low back pain, and can also cause a radicular problem. Spondylolisthesis can be congenital and degenerative. Congenital is a problem that we have from our birth, of course, and it is worsening during age. Degenerative spondylolisthesis is a pathology that occurs in elder age, after 50 or after 60 years old. The treatment is always the same. First, we can do some physio, we can have some bed rest, we can wear a belt, we can use painkiller, muscle relaxant. But after a few months or years of pain, the only solution is also in this case surgery. Surgery, because we have to avoid the mobilization of this vertebra, so we have to fix the vertebra, and we have to remove the compression of the nerve. Sometimes usually the kind of surgery is to stabilize the spine, So stabilize the spine means that we have to fix with screw and plates the vertebra that is sleeping, and we have to decompress the nerve. In this type of surgery, a patient generally can walk after maximum 2 days, and in the 4 or 5 days can be discharged at home. It's a surgery that lasts about a couple of hours, no more. It's very, I mean, it's not easy, but it's many frequent. So it's like a surgery that we can do everywhere in every in every situation. So this is the most common pathologies of the spine. The other pathology that, I mean, is not strictly surgical pathology is lumbar pain. Lumbar pain, it depends on our way of life, it depends on our work, it depends on our sports activities, it depends on many things. Most of the times low back pain can be considered like consequences of this kind of things. So we can treat low back pain with some painkiller, some muscle relaxant. We can also do some physio, but sometimes it's necessary to do some injection in the spine, injection in the spinal joint between the vertebra. We can inject cortisone, of course, and some local anesthetics. Sometimes, if we can do this kind of injection for twice a year, for example, every 6 years, we can solve the problem. Other kind of pathology of the spine, I mean, there are so many kind of pathology. Disc herniation can occur also in cervical spine, and the treatment is always the same. The pain medication, physio, and after a few days, about 3 weeks or 4 weeks maximum, the surgery procedure can be performed. Surgery procedure that we do in supine position. So for the lumbar spine, the position in the OT is a prone position. Supine position with a very little excision in the anterior part of the neck, so we can remove the disc and put a cage in the site of the disc. Also in this case, it's a very quick surgery. It's about, 1 hour maximum. Patient can walk absolutely after a few hours, and after 2 or 3 days can be discharged at home. These are the most common pathologies of the spine. Other pathology in which I am really expert is something like called scoliosis. Scoliosis is, a permanent deviation of the spine. It can be an idiopathic scoliosis, so a young lady, a young boy. It can be a degenerative scoliosis. Sometimes we can perform surgery, of course, if the scoliosis degrees are very high, more than 40 degrees, in 40-45 degrees in a young patient. And but in this case, they absolutely do not have pain, because lumbar idiopathic scoliosis doesn't cause pain. In elder patient after 50 years old, also a little degrees of scoliosis can cause pain, and in this case we can do a lot, or we have to prescribe to the patient a lot of physiotherapy, a lot of exercise, swimming, cycling, and the gym, just in case in which the pain will not relieve. Of course, we can do surgery. We do a lot of this kind of surgery with complete satisfaction of the patient. That's why I'm here to Shark Hospital, just to do this kind of surgery, this kind of treatment, because not all the patient has to undergo surgery. There are a lot of pathology of the spine in which we can we can do treatment or surgery. But the most common, they are these three or four kind of pathology. Other kind of pathology is that cause low back pain is the sacroiliac inflammation. Sacroiliac inflammation we can manage with physio, of course, no painkiller, no muscle relaxant, because they are completely useless. And sometimes after physio, after exercises, we can do some injection in the sacroiliac joint. Most of the patients that has lumbar pain, low back pain, is because of their style of life. So we can manage in some way to do some sports, because patients usually has a heavy work, and then sitting position for most of the day. So you have to avoid the sitting position for 10 hours or 12 hours. You sometimes have to do a walk, or you can go to gym, you can go to swim. You have to move your muscle. So as the age will go on, your muscle has to be strong to support your spine, because we have to remember that spine is not just bone, as you can see, this vertebral body, this joint, this disc, but in the posterior part of the spine there are muscles. So as much as we reinforce the muscle, better we stay for our spine, for our pain, and for most time of our life. Sometimes we do heavy work, so lifting heavy weights can cause obviously spinal low back pain and also thoracic pain, because sometimes we lift weight in the wrong way. So we have to avoid lifting heavy weights, and we have to care about our safe and our body. So in conclusion is that you don't have to be scared about spine problems, about low back pain or cervical pain, because in most of the cases we can solve the problem without surgery. So we can do, as I told before, physio, we can do some activities, but you have to come to us to say us which are the problem, which are the pain, because we have so many ways to treat the pain and to solve the problem. I repeat, in most of the cases the solution is not surgery, but there are, when you feel pain from a long time, from 6 months or from 1 year, I'm sorry, but you have to understand that the only solution could be surgery procedure. Thank you, everybody. Have a good day.